Hello, everybody. Welcome, and thanks for coming. And let me just turn this on so I make sure I stay on time. It's great to see such a crowd on this for the last event and getting towards the end of the term too. It's a real pleasure to sit here and actually be a speaker for once in the series. Chris finally convinced me after 2 years now of doing this that I guess it's about time that I come and do a presentation as well. And so I'm really excited to sit here and stand here and present to you some work in progress that Chris and myself and some of our colleagues have been working on and use this forum to get some ideas out of you too. No such thing as a free lunch, as they say, particularly in regards to some of our findings and how they might relate to some more urban and some more rural areas of British Columbia. So without further ado, I'd like to just get started. And I always like to say that when you're doing studies on social capital, it really takes a bit of social capital to get it done. So there's a number of different people and institutions I have to acknowledge. The work today was heavily funded by a Shirk Standard Research grant, as well as some supplementary funding from the Canadian Institutes for Health Research, the Human Early Learning Partnership, as well as even some money from the UBC Arts Undergraduate Research Funding Award stream. Also, I'd like to acknowledge my collaborators on this project, Christopher McLeod, the gentleman sitting right up here up front, who I've had a heck of a lot of fun doing some of the really geeky analyses that this project has entailed. Alec Ostry from the University of Victoria, Department of Geography, Paul Kershaw at the Human Early Learning Partnership, as well as acknowledging the very helpful work of Robert A. Malatest and Associates, who did our data collection, as well as some help staff. Mr. Anthony Smith, who's done a lot of really great GIS work for us and helping us to further this work, as well as Dr. Barry Forer. So for today, what I'd like to do is, I'm getting a little out of my element today, so please bear with me. I'm not used to giving really heavy methodological type talks. I'm used to always having, I always feel a little bit more comfortable theorizing. So today's going to be a little more methods and empirically heavy, I guess is the best way to think about it. So, I would like to start off with just critically considering why the heck we should even bother to study neighborhoods. And go through some thinking about how that plays out for research in terms of thinking about the data that we use, the measures that we create, and then from there detail an approach for generating new measures of neighborhood context, specifically ones that are focused on collective community life within neighborhoods. Then what I'd like to do is show you how we evaluated this approach for assessing neighborhood social capital, among some other measures, but I'm going to focus today on 3 measures of neighborhood social capital in both rural and urban BC contexts, and then discuss its implications for population health as well as other areas of focus, because what I'm talking about today could easily extend over to general studies of community and urban and rural development, social work, geography, things that non-health areas in general. So I'm often presented with a number of questions when I tell people that I study neighborhoods and I study community life. People kind of look at me and sometimes they might pose this question to me: why study, or why should we even care about neighborhoods? And I think John Donne said it best in his poem that no man is an island, that no person is an island unto oneself.
He said man.
He did say man, yes he did. It was the 1600s. We've come a long way, but the basic gist of the poem is this: that our well-being depends upon our environment and the people within it. So in essence, getting at the notion of geographic community. As human beings, fellow citizens, we are organized in a physical space. Where we live isn't random. It's shaped by social, economic, cultural, political factors, physical factors. You might not be able to live on the swamp. You might have to live over there because there's water in the way. There might be a mountain that prevents you from putting a house up. So the physical intersects with the social. We can think of neighborhoods as sources of social status differentiation. You can get very sociological with this, thinking about how things like class, political, demographic, and cultural aspects shape our access to resources, as well as shape lifestyles. We can also think of neighborhoods in just a more general or abstract sense as life spaces. Places where we're influenced by amenities and hazards, and that are in turn modifiable by human activity. So a bit of a dyadic relationship here. And something else that I think is very important to emphasize here when as someone who studies community. I'm not here to celebrate community, I'm here to study it. So when we think about it in this way, it forces us, or at least the way I think about it, is that community can be good, it can be bad, it can be even null, have no impact on something. It's an empirical question, essentially. A follow-up question that I get from this is, well, that sounds pretty academic, Mr. Ivory Tower. I would argue not at all. It has very practical implications. Quoting from Gino Baroni, the late community organizer, was a civil rights activist, the neighborhood is the building block of city planning. City in a general sense, even we could say town planning. Very relevant for the talk that I'm going to, and the issues that I'm going to raise today. He argued that people in neighborhoods know more about what ails their communities than do outside social workers and urban strategists. And just finally, the degree of neighbor interaction, the degree to which people in a community socialize with one another, is a key indicator of community strength. Second question I get asked is a neighborhood community an outdated idea? I mean, we live in the Twitter world and the Facebook world, and well, we extend now. We have cars, we have telephones. Did you not get the memo on that? Maybe this is an outdated concept for thinking about community. People maybe don't necessarily engage with their neighbors as much anymore. Well, here's some data that I've been recently analyzing from the 2008 GSS with some undergraduate students, sociology students. And this is for respondents ages 18 and older who reside in large urban centers. I also looked at data for the rural areas. I'll get into that in a second. We can see here that people do know their neighbors. See here, the percentage of people who say that they don't know a neighbor is relatively small. People, when it comes to responding about knowing people in your neighborhood well enough to ask for a favor, so not just recognizing somebody and waving hello, but actually a certain degree of closeness or intimacy, we see here fairly large numbers as well. In terms of actual favor exchange, we see a fairly high percentage as well. Well over half responded, 61 and 67%. So there's some people who receive a little more than what they give, or vice versa, or give a little more than they receive. But nevertheless, this data certainly indicates that while we may not be using neighborhoods as our central focus of social life, it still does play an important role in people's lives. That gets us to the question of how then does local community life matter for health and well-being? Over the past 15 years, almost 20 years, we could say, there's been tons of research on this, what would generally be termed neighborhood effects studies. How do the effects of a neighborhood context, a neighborhood environment, impact individual outcomes, impact group outcomes, controlling for characteristics of individuals? How does the environment impinge on us in good and bad ways? Many of these studies to date have focused on neighborhood socioeconomic status, things like the concentration of poverty within a location, the concentration of affluence, and the different implications that might have. Income inequality, residential turnover and stability, what implications that might potentially have for thinking about networks and ties that people are able to keep and maintain. As well as even demographic composition, identifying ethnic enclaves, for instance, or ghettos, depending on what your conceptualization might be. However, there's still less work that gets done on trying to understand what are the mediating mechanisms, the neighborhood level mechanisms through which these factors operate to affect health and well-being. And a big limitation to that is the data that's available to test the different theorized mechanisms. So most neighborhood effect studies measure area context using census or administrative data. The pro of that is that they're fairly easy to use. Thank you, Stats Canada, for your wonderful interfaces, and we can download the variables that we need, and we can append them very nicely to some survey data set that we might have based on some sort of geographic identifier. U.S. Census Bureau, fantastic website as well, easy to use, easy to get work done. Certainly the measures are very good for that we might have. But there's some big cons that come with that too, in that the type of data that's there limits us in the types of constructs that we might want to measure for testing specific theories. So here's some of the common things if you were to do a literature review. If you were interested in studying the effects of area socioeconomic status on individual health and well-being, you might use median income, percent who make over, say, $100,000 a year, percent of the people who are below the poverty line. You might even go all very fancy and calculate the Gini coefficient to be able to understand what is the degree of income inequality within a location. Get more fancy with that. You might look at relative concentrations of affluent and poor using something like the index of concentration at the extremes, like I have with some of my colleagues. You might even go the education route and look at what's the concentration of people with a college degree in a particular location. Is this a neighborhood that's characterized by individuals who generally are in managerial or professional type occupations versus more blue-collar occupations? If you're interested in looking at residential stability, you're generally limited to things like the percent who've lived in this location for whatever past number of years the variable is. Sometimes people use percent of home ownership. What percentage of the homes in a neighborhood are owned or owner-occupied? That gets tricky though too. Homes measure wealth. So now you're not getting into distinct things. You're capturing SES as well. And you might actually then pull into some demographic composition variables. The typical ones being just calculating a crude percent of whatever ethnic or racial category you're interested in. Insert that there, and there's your measure. Percent white, percent Chinese Canadian, percent African American, percent Latino, percent immigration. Sometimes there might be, there's some work that has been looked upon at certain age structures within a community, what implications it might have to be if a community has predominantly older residents versus younger residents running around, little ones. And even, in some cases, looking at things like measuring gay or sexual minority enclaves by looking at the percent of same-sex households. Some interesting work I've been able to do there with some colleagues in the United States. So given this interest and given the data availability, where does this leave us? It leaves us in a situation where we need area measures that capture other aspects of community life. Some examples might be things like, what is the degree of cohesion within the community among residents? What are different types of social capital forms that might emerge? Different types of resources that might be emergent from the relationships of the residents who live there? What types of cultural scripts might there even be within different neighborhoods? Different values that residents might have about different things, ranging from permissiveness or tolerance about drug use being done in the streets, or public drunkenness, or other aspects of what might be viewed as social or even physical disorder. Or in the case of David Harding's work, attitudes towards teen pregnancy, early sexual initiation. So this prompts two key questions then. How can we collect such data and do it in a feasible manner? And can these resulting measures scores be reliable as well as be valid? Okay. There's an approach that says that this can be done. Something by the name being termed Ecometrics. Often if you do a Google search for this stuff, Google even thinks you're wrong in how you spell it. It says, are you sure you didn't mean econometrics? No, I wanted ecometrics. It's developed by, the idea was developed by Stephen Raudenbush and Robert Sampson. And what it is it's a quantitative approach for assessing social and physical properties of ecological settings. We can think of this as a area or a contextual level analog to psychometrics, where we might be evaluating different scales of individuals. Now we're evaluating measures related to places. One application in this ecometric approach has been to create area-level measures using survey-based responses regarding community life. When you have clustered samples, when you have a number of respondents located within particular locations. And this approach has been found to create reliable and valid scores when you have anywhere between 25 or 35 respondents per neighborhood. However, it still has had relatively limited applications. Most of these have been in the urban United States as well as within cities. Two examples of them would be, Roundbush and Sampson's work on the project on human development in Chicago neighborhoods, which is a study of over 300 neighborhoods within Chicago, as well as the Los Angeles Family and Neighborhood Survey, which I've done a lot of work analyzing and using this approach to create some measures. That's 65 neighborhoods within Los Angeles County. So for the present study today, I want to apply this ecometric approach and show you our application of this to data collection in urban and rural communities across British Columbia. And I'm going to evaluate two questions. How many survey raters per location are needed for reliable measures of local context? And how valid are these measures' scores? The data that I'm going to use for today, or that this analysis is based on, comes from a random digit dial computer-assisted telephone interview survey. It's a lot of acronyms there, of adults that was conducted by Malatest and Associates, an outside contractor. We had 2 data collection phases as well as a pilot test. And our neighborhoods were selected on 4 criteria. We needed sufficient population density. If you're going to do a telephone survey, it doesn't work if you're looking at a location really where 2 people on the same acre is kind of considered a crowd. It's a little difficult, particularly given non-response. Because this was done in conjunction with the Human Early Learning Partnership, they already had a classification that was based on some needs of theirs in terms of looking at early child development throughout the province. So we used some classifications of communities that they had, as well as some overlap with rural communities that were studied by Alec Ostry, our collaborator on this. Also within rural neighborhoods, within rural areas, to really get a notion that what we were trying to get at was a true neighborhood, we also used GIS approaches to validate postal codes that represent particular population clusters. We had 2 data collection phases. The first phase we used to determine the number of raters that were needed for reliable neighborhood measures. So this was done in 2009, late 2009, with a little less than 2,100 respondents located within 41 neighborhoods. Originally, we had about an even split of urban and rural, but when we went back to do the GIS reconfiguration in order to make sure that our area boundaries were refined and ecologically valid, it came out to being 26 urban and 15 rural neighborhoods. Within each of these, we had a minimum of 50 respondents per neighborhood. Phase 2, then, we combined with Phase 1 and used that data to determine the validity of the neighborhood measures. And this data was collected then in the summer of 2010, and we had a little under 2,500 respondents from 59 neighborhoods, and a minimum there of 40 respondents per neighborhood. And I'll get into just a second about what was the justification for using 40. So this was a whole survey, but for time today and for illustrative purposes here, I'm going to focus on three constructs for which we collected measures on. First is social cohesion, informal social control, and intergenerational closure. Social cohesion we can conceptualize as just the degree to which residents interact and share similar values. In previous work, I've made the argument that this is the basis upon which social capital can be built. You need people to be able to know each other, to build bonds, to become embedded with each other within networks in order for there to be any sort of resource sharing, in order for our network ties to have some sort of value. Before you can borrow that cup of sugar, you need to know who your neighbor is. Unless you live in, I don't know, I guess a particular community which just tends to be open and knocking on doors and people hand out sugar bowls. I don't know, but empirical question perhaps. To measure this, we used a 3-item scale that was modified from some prior work done in Los Angeles as well as Chicago. We had a reliability of only 0.53, but that could also be a function of the fact that we only used 3 items. These items were people in this local area, meaning an area within a 15-minute walk from your home, are close-knit, generally don't get along with one another, and do not share the same values. And this is where attitude measures coded from strongly agree to strongly disagree. And the way we did the coding for all these measures is such that higher a score, the more people would agree with the items. So higher social cohesion score, more positive assessments. Second measure, informal social control, assesses the degree to which residents are able to collectively maintain order and enforce specific local norms. And again, we used a modified scale based off of these two prior studies in LA and Chicago. In this case, we used three items to assess informal social control. Basically vignette or hypothetical situations. Given a particular situation, how likely is it that people in your local area would do something about it? These situations were children skipping school, if you found that some children were spray painting graffiti on a local building, and a child was showing disrespect to an adult. And once again, local area was a 15-minute walk from your home. And the third construct we measured, intergenerational closure, assesses the degree to which adults and children in the community are linked, and the degree to which adults are invested in the local children's development and well-being. This was assessed with a 4-item scale. There are adults in this local area that children can look up to. Adults in the local area know who the local children are. Adults in this local area can be counted on to watch out that children are safe and don't get into trouble. And neighbors can be counted on to look after any preschool children, grandchildren, nieces, or nephews in your family. Now, the first 3 items have already been used in the Los Angeles project. This 4th one we also created. Also, I guess is important for backdrop, given the fact that this was this project was done in conjunction with the Human Early Learning Partnership, which is very interested in looking at early child development. A big focus of our project was on children. So some of our measures do certainly reflect that. So the first question, how many respondent raters are needed for reliable measurement of context? This is where we're going to use the phrase one data, where we had 50 respondents per neighborhood. Here's where we start getting fancy. I'm going to have to use Equation Editor for this presentation. I felt I'm going to admit this now on YouTube, that somebody who didn't do so well in his undergrad calculus courses, but never got less than an A in his stats courses. This is sort of unusual. So I was very excited to have to use subscript and pi and all other Greek letters. So we computed the neighborhood-specific reliabilities by specifying 3-level mixed models. For those of you who aren't familiar with these, as this great book I have on my bookshelf says in my office, multi-level analysis, it's just regression. So essentially we can think of these as standard regression models that try to take into account clustering of responses. Clustering within neighborhoods, clustering of respondents within neighborhoods, and clustering of items within respondents. Because remember, each respondent was asked for each scale to respond to multiple items. Our level 1, so we can think of these as essentially as nested models, just to walk through for the people who are a little less familiar with this. The first level is going to models variation in the scale item responses. So this is saying that the response to an item I of person J living in neighborhood K is a function of not just the scale item responses in level 1, but then also at level 2, the variation between between respondents. So it's recognizing the fact that each one of you, if I were to give you this survey, would have different patterns of response. And we're trying to take into account that variation. And we're also trying to take into account the fact that response variation will vary among each one of you as well. Okay? So each of you as respondents will have, because of different backgrounds, of other sorts of factors that might be going on, might answer or even perceive these items or characteristics of your community in different ways. And then lastly, model 3 models variance between neighborhoods. The idea here that responses might differ between communities, taking into account that contextual difference. And we ran those models in a simulation type of style. We ran 100 random samples that were drawn from that phase 1 data for each of several different sample sizes. For a sample size of 25 respondents per neighborhood, 30, 35, and 40 respondents per neighborhood. And so for each one of those set number of raters, we set the computer to run it to try this out and randomly draw respondents, draw 25 people from the sample of 50 per each neighborhood each time. So we would have a different sample, and we could estimate stability of our findings. And from these results, we calculated a neighborhood reliability coefficient, which looks really fancy. All it is actually is simple math if we can get past some of the symbols here. And essentially, all this is saying that reliability is the variation across neighborhoods divided by the total variance in the data, which is your variance between your neighborhoods in those responses, variance between the respondents within a particular neighborhood, taking into account how many respondents might be in the particular neighborhood in which you live, as well as the variation in your particular responses to particular items. Also taking into account number of people within a neighborhood, as well as the number of items that might be in a particular scale. Please interrupt me at any point if any of this gets a little confusing or you need some sort of clarification. I don't have a problem with that. And then what we ended up doing then was once those numbers got estimated, we averaged them across the neighborhoods and used a cutoff point of 0.8 or higher, which is generally what gets used for looking in a psychometric analog. We would be looking at a particular scale. We would say, well, if we have 0.8 or higher, it's pretty good. General sort of standard, there's not really much talked about as sort of what would be the gold standard with this, but we used a cutoff point of 0.8 or higher as well for looking at the neighborhood level reliability. And here's what we found for each of the three scales, broken down into both the total sample as well as within urban and just rural neighborhoods as well. And we can see here the different setup for the different, I show results here for 30, 35, 40, as well as the full sample of 50. You can see here that generally across these measures, in most situations, well, in a good portion of the situations, we can get at reliable responses at about 35, even at 30 respondents per neighborhood, which is a lot less than actually what we thought we would probably end up doing. 0.79, 0.73 for social cohesion still actually would be pretty decent, but we set a more stringent bar for it. And so we can see here that about by 35 improvement, 40 we definitely everything hits that mark. So the implications of these results are that then we said, well, it looks, if everything's looking like we're hitting it around 35 or 40, let's choose 40 for the second phase of our data collection, 40 respondents per neighborhood. That seems to be what we're able to get reliable estimates in regards to these three constructs. Also, we wanted to take into account the fact that when we did further data collection, there's going to be missing data. If we can, we needed to take that into account as well. So if those cases are going to get thrown out for some reason, that could affect our later results as well. And so then we applied these results to the remainder of the data collection. And knowing that we ideally needed 40 respondents per neighborhood, we can then simply do some math with this and say, well, if we need 40 respondents per neighborhood, and we know that it's going to cost us, let's say, $30 per survey, $40 per survey, we can come to an estimate and take our existing budget, divide that number from the existing budget, and that gives us how many neighborhoods we can afford to sample. So that takes us into the next question. if we can create these valid measures, how valid are they? And this is where we use the phase 1 data as well as this new phase 2 data. So here's the descriptive statistics of the 100 neighborhoods from which we collected data. These are based off of Census data. The first variable we have here is household income, a household income-based index of concentration at the extremes. And what this is just it's measuring the relative concentration of affluent and disadvantaged people within a neighborhood. So I have a little formula here, but to help you through it here. It's the number of households that are making over $100,000 or $100,000 or more per year, minus the number of households that are making less than $20,000 a year, divided by the total number of households within a neighborhood. Usually this measure is constructed such that it only ranges from -1 to +1. If everybody in the community is affluent, you would have a score of +1. If everyone in the neighborhood is poor or disadvantaged, you'd have a score of -1. And if there was a relatively even concentration, you would be at 0. For interpretation and for interpretation reasons, we decided to put it on a percentage scale. So we multiplied this by 100%. We took the same approach in designing, well, actually, let me first explain. We used also percent unemployed and percent with a college degree. And then for looking at age, we used a similar approach with the ICE that we did for income. But in this case, it's the number of people that are 65 and older compared to the number of people in the neighborhood who are under age 18, divided by the total population. So once again, that would give us a +1 to -1 type scale. In this case, we multiplied it by 100%. Oh wait, I'm jumping ahead here. So here is in terms of walking you through just sort of the layout of the neighborhoods that we ended up having for this, we can see here that a score of -2.4, for instance, for the ICE means that there's, on average, each community had a relatively even distribution. Most of the community, on average, our communities, about approximately 20% had a college degree. In terms of age structure, we're seeing here relatively even distributions of older and younger residents. And on average, in terms of residential stability, we see the average score of 47%. Within these communities, on average, 47% of the people had lived in these locations for the past 5 years in urban, and 43.4% in rural. And immigrant concentration, as we would expect, was more likely to be found in urban locations versus rural. So for this sample, for this stage of the analysis, we created neighborhood level measures from our data. This involves a variation on the approach that I just showed you in terms of estimating reliabilities. A standard approach might be that what you would do is for each one of these neighborhoods, you would take a variable and you would aggregate respondent scores up to a neighborhood average. Just take a simple average of 40 or 50 people who are within a community, and they all on average scored a 10 on a 20-point scale. That can work, but the problem is that you have a lot of confounding that gets built up with your ecologic measures, and that has a lot of implications for your analysis. So what we did here was estimate variables, created measures, using a multi-level model that could take into account some of those confounding factors from the respondents who were providing the information from which that neighborhood average would be based. And once again, this is a 3-level multi-level model. Level 1 estimates, once again, responses to items within each respondent. So each one of your responses to items on the scale. Level 2 is between respondents. Now we're trying to take into account different demographic characteristics of each one of you in the room here and how that might influence your responses. So we're able, at this part of the model, to adjust for things like gender, age, education. I think was about 12 different demographic variables, if I remember correctly, put in there. Offhand, some of the other specifics, but some of the general basic demographics and things that might influence people's responses. Level 3 estimates the between neighborhood variation in these scores. In this case, we didn't include any control variables here. We wanted to actually estimate then how these average responses vary across neighborhoods. This is the stuff that we're really interested in. This B0K would be the average response within a neighborhood, and then the mu 00K is the variation around that average neighborhood score. Once again, please stop me if there's any confusion. From these models, we can do something really helpful. We can derive what are called empirical Bayes residuals that then we can use as contextual variables. And what these residuals are simply they're mean-centered deviations from the grand neighborhood mean of the scale. So going back to the previous slide here, they're estimated based off of this. Here's the mean. We're interested in the variation around that. So if we centered that at 0, and we just said, here's the neighborhood mean, this would be the 0, we want to see how everything else revolves around that. This is what the empirical Bayes residual is helping us to estimate. What we then ended up doing was we z-scored these so that this way we could make some standardized comparisons across our scales. So now these residuals, we save those basically as a variable, social cohesion variable, neighborhood social cohesion variable, a neighborhood informal social control variable, a neighborhood intergenerational closure variable. We z-scored them, so now they have a mean of 0 and a standard deviation of 1. And what these measures allow us, or what they're advantageous for, is that now they're adjusted for each respondent's variation to responses to the items, as well as their socio-demographic characteristics. So this is an improvement over just doing a simple neighborhood level aggregation. It's adjusted for the confounding, as well as it's a little less an issue here with our study, but it would be more of one where we might have very unequal types of sampling across different neighborhoods. Maybe there might be 15 people in one neighborhood and 50 in another and 45 in another. You've got all this kind of variability. And the estimates might be a little bit all over the place because in places where there's fewer respondents, they might be less reliable. Using this method, you're now estimating a mean based off of a model. You're not basing it on just, here's neighborhood X with 15 people, and I'm going to calculate a mean. And here's neighborhood Y that's got 50 people, and I'm going to calculate a mean. Statistics 101, we would say, well, 50 should have a more normal distribution than the 15. By combining the data all into one and estimating information, using all the information from your sample, you can get more reliable estimates, even for those locations where you would have fewer responses. These are empirical Bayes residuals are sometimes referred to as shrinkage estimators because they weight values according to reliabilities. And so items tend to be shrunk, or scores rather, tend to be shrunk much more towards the mean. So you have, it takes care of, adjusts for outliers. So the next thing is, great, we did all this sophisticated stuff. What does it tell us? Other than the fact that, we can use equation editor in PowerPoint and Word. What I have here are just some simple correlations among the different contextual variables that we estimated, these empirical Bayes residual derived variables. So let's see how they correlate with one another. And we have it broken down by the total sample, just the urban specific locations and the rural locations. And we see here that social cohesion And looking at informal social control, both the total and the urban sample, a little over 0.7 in terms of a correlation, positive correlation as cohesion goes up. As we would expect, informal social control also goes up. Very similar response, actually a little weaker than what has been reported in some of the US studies. Stuff that I found looking at Los Angeles data, for instance, but nevertheless pretty good and certainly makes sense conceptually. We see a similar pattern of results when we look at social cohesion and intergenerational closure. Sorry, I know these are always confusing, putting up there was no real nice way to put up a correlation matrix to show you these things, particularly when it's broken down into three sorts of samples here. So there is some redundant information here. But lastly, how does intergenerational closure correlate with things? And we see sort of similar levels. Always seems to be around a point somewhere between 0.55 and 0.78. So a fairly high degree of correlation, but if you think about it, I mean, now let's square that, and we're talking here about a little under 50% of shared variance. Actually, no, a little over 50% of shared variance. Yeah, sorry, my math's a little off. Now, in terms of assessing validity, let's see here, how do these items correlate with the census variables? Do they correlate in the ways that we would expect them? What might this tell us about particular locations given certain socio-demographic profiles? And we see here again, I have social cohesion broken down again in terms of the total sample, the urban specific sample, and the rural sample. And we see here certainly a differentiated pattern of results depending on urban and rural locations. As income goes up, urban locations, as the concentration of affluent people within a location increases, we see here that in urban that's positively associated with, or results with it's correlated with higher social cohesion in urban locations, with a slightly negative relationship in rural locations. Percent unemployment, the pattern flips. As unemployment increases, it's associated with lower social cohesion, fairly consistent with literature, but the literature also tends to be very heavily urban focused. Rural locations, we see a positive association, albeit a fairly weak one. Education, concentration of people with a college degree, positive in urban locations, negative and much stronger in rural locations. Age, as there's more older, over 65 respondents within a neighborhood, positive association with social cohesion. Residential stability, as we would expect, at least in terms of, as we would expect it generally, but we in terms of residential turnover might make it more difficult for people to establish ties. Neighbors might constantly be changing. We only really find that association in rural locations, not in urban locations. Find the opposite effect. Immigrant concentration correlation is much stronger in urban locations. Informal social control, then, when we turn to that, see, once again, it's positive correlation as the concentration of affluent people in both urban and rural locations increases, albeit it's much stronger within urban locations. We see a consistently negative association with unemployment, divergent findings for as you have more educated locations, and positive associations with higher concentrations of older residents. As there's a relatively new, another way to think about it is, as there's a relatively new turnover in a location, we start to see that informal social control is lower. And immigrant concentration, different effects here. Higher immigrant concentration is correlated with lower informal social control in urban locations, but positively correlated in rural locations. And here for the discussion is where I would love to be talking about some of the substantive implications of some of these findings. So the big take-home point is, aside from just focusing on specific numbers and everything else, the big pattern here that I want you to think about here is, before I showed correlations that seemed fairly high with each other and not too discriminating, in the sense that they were all relative, more or less around 0.6, 0.7-ish with each other. But yet we do see some very different patterns here depending on what the indicators are. So there is something going on here in terms of concordant and discriminant validity. Once again, here we see that increase of affluent people within urban locations associated with more intergenerational closure, degree to which people are really know the local children, looking out for them. We see a different pattern within rural locations, yet a consistent finding of where there's more unemployed residents, more intergenerational closure, both in urban and rural locations. Yet, curiously, where there's more educated residents, lower intergenerational closure. Also different patterns based on age, similar pattern based upon residential stability and immigrant concentration. So, getting to the discussion of this, what exactly does this all mean? It's important to remember, once again, that community contextual data is hard to come by. We have to be very creative in doing this kind of work, of the kind of data sources that we have access to, whether it be census data, whether it be some of the new studies that are finding that Google Map actually is a very reliable way to actually code certain locations. Some interesting stuff, and other sorts of creative ways to get at data that might be available. Administrative data, other sources that people might have for other projects and be able to link them in, things collected by city government versus federal government, hodgepodge. This ecometric approach seems to work for the urban and rural BC context. It allows us to create measures that have good between neighborhood internal reliability, as well as convergent and discriminant validity. That's similar to other studies. But there's some limitations here that we do have to acknowledge. We had a low response rate. Low. I'm getting that on camera. Roughly about 12%, using some standard formulas that we're not quite sure exactly, because of the fact that we had some clustered samples and some things, but nevertheless, that's a conservative calculation, we think. But it's important to recognize too that a low response rate doesn't necessarily mean a high non-response bias, because in this situation we're asking people to report on collective phenomenon. And what's been found is that non-response bias is less of an issue when you're asking about those sorts of items, about things that everybody can cue in on and offer an opinion, versus something that might be very personally specific. We didn't have a randomly selected sample of communities. We had more of a purposive type sample. We also had a low number of rural communities. So that certainly has implications for some of the results reported here and some of the stability of our estimates. Our neighborhood scores are not based on representative samples within each neighborhood. We had a relatively small number of respondents. So our measures might be internally valid, but they're not externally valid. So I can't take a specific score for neighborhood X and say, oh, people within that community feel this about it, and generalize that to the entire neighborhood. That said, there's a number of strengths here. We were able, using this method, to create some unique and hopefully useful BC area data. The between city-based results that we have here, because these were collected from locations all throughout the province, are similar to within city study results that reported elsewhere, Los Angeles, Chicago, but they identify also phenomena that are distinct to BC. Okay? And we're able to look at rural locations, whereas a lot of other studies have not. This enables us to do some nice theory-driven tests of different mediating and moderating mechanisms that might link some of those findings that are based on census-based measures. So area socioeconomic characteristics, for instance, and looking at their effects on well-being. So this can fill a big research gap here. And this informs future studies regarding the feasibility of data collection, in the sense that we know that this can be done, and it can be done relatively cheaply. I mean, the project did hit the 6 figures, but relatively speaking, given other methods, we can certainly think of far more expensive ways to try to get at similar types of data. Also, too, it's important to remember, too, we looked at 100 neighborhoods here. So for smaller projects, we might have something that's a lot cheaper. So in conclusion, the ecometric approach allows an assessment of aspects of community context that aren't typically available by the standard types of data sources that we might traditionally use. And I want to emphasize, we looked at 3 different types of scales here, but you could get very creative with this. And it has been used in creative ways, but I think we're still sort of at the tip of the iceberg on this. Forget about social capital. Just think about local culture and cultural aspects of the collective environment here, and what sorts of creative things could be done there. Some analyses by David Harding, the appeared in American Sociological Review, not using exactly the same ecometric approach here, but using sort of a similar logic, created area-based measures of local culture in regards to, for teenagers, in regards to sexual activity, and was able to look at and test theories from the sociology of culture, about cultural scripts, and how there might be different cultural schemas that teens pick up on or might compare in terms of shaping their own behavior and their own decisions. In this case, about sexual behavior, but we could imagine other things, substance use, for instance, other health practices. So this furthers research, not just research, but policy and practice too, because it's improving our measurement and evaluation of specific community mechanisms now. If poverty is bad, how is poverty bad? What is it doing to a community? If there's a whole bunch of affluent people that are living, what is that concentration of affluence contributing to the quality of community life? So this will also can help us to improve our evaluation of existing community interventions, explicitly and implicitly. If we're able to collect this from a large enough sample, we can be thinking strategically here. We've got this community that's included in here, or these, and we know that they have a specific program that's going on. These haven't. So we can be thinking here about different sorts of natural experiments too. Economic downturn that might be affecting one location versus another one, for instance. And this can help to inform the design of programs and policies to improve health and well-being of specific populations. So we can be using this information not just to design different sorts of programs and types of interventions, but also to be refining ones that might be in place. I always like to get back to this when I talk to my students about neighborhood effects. So much of the literature is always about, let's take a general sample and let's append a whole bunch of area level variables, and let's see an average effect when we model it about what this location will mean for average citizen who lives in this location. That's nice, and it's neat that they find findings and that they're, and we hope in some cases, some studies more so than others, that there's some sort of theoretical meat and explanation as to why we would find that association. But it's important here that we think about, if we're thinking about how place matters for health, we have to think of 2 questions: for whom and for what. So for whom do neighborhoods matter, and for what outcomes? I study adults most of the time, but we certainly can think of the fact of, who uses their neighborhood probably more than anybody? Kids, right? People who are home more. So we can certainly see that there might be gender differences that might be occurring. Age differences. The unemployed. The retired. So we can be thinking here about specific subpopulations for which might be getting greater exposure to both the good stuff and the bad stuff that communities can provide, and what implications that might have for some very subpopulation specific type outcomes, whether it be early child development, whether it be substance abuse, whether it be delinquency. And we don't have to be thinking here in pop health terms, that delinquency just cued me. We can be thinking here about other things. Job opportunities, other types of sharing of information, personal safety, community empowerment. So I'm going to end there, and I'd love to hear your thoughts and thinking about some of the findings on this. If you have any questions, please feel free to contact me. If you have any complaints about this talk, my two colleagues elsewhere would be happy to hear them. And I'm so glad this is getting recorded. There's a long inside joke story about that we can talk about later. Anyway, thank you very much. You've been a great audience.
Rich, can I get a clarification on how you measure rural?
Yeah.
As someone who spends most of their time doing rural, and what is a neighborhood in a rural area? Because you didn't articulate that.
Yeah. Okay. Okay. So the question, because I know that the questions don't always come up so great on the video, is how did we measure rural? I didn't measure rural actually, which is the simple answer to that, but that's not satisfying. The Human Early Learning Partnership measured rural through their existing communities and the surveillance that they do. So they have already used, they have a team of GIS specialists and mappers who have more, well, places that, I mean, obviously to anybody would say, well, that's definitely a rural location, but then going in and really thinking about this. But then how do we think about what's a neighborhood within a rural location? And that was certainly a concern for us. There we were able to identify population clusters and look to see, with postal codes as well as, well, it's more of sort of an iterative process, really, of just seeing.
Rural communities have only one postal code.
Yeah. Well, yeah. So, I mean, in this case, we were, now I forget, I wish Anthony was here to go into the specifics of this. We had a lot of meetings about this. And when we had a more detailed, we had a much more detailed, nuanced way of doing it than what would typically be done, which would say, right, take the rural postal code, and that's somebody's neighborhood, even though it might be 30 miles wide and have no real ecologic validity to it whatsoever. But in this case, we were able to actually see, sort of what would be the center of town, what are the people there, and so in this case, getting people who would be reporting on life, who were proximal to other individuals, and where we could hypothesize that there's some emergence of community life that would be coming from it. Yeah. Without, of course, trying to sample on a dependent variable in essence. That's. I can get more details on that though, but yeah, I don't have them handy. Should I handle my own questions, or
I think you're doing great.
Am I doing great? Okay. Yeah. All right. Excellent. Yes.
Unless if they get too rural, I'll step in.
Okay. Thanks. My henchman here, I guess. Yes.
Hi, I have a couple of questions.
Sure.
Similar to the question previously asked, how did you select your neighborhoods and communities?
Mm-hmm. That actually we would have. Was another multi-stage process because it involved. Because we had a number of considerations. So this project, in a sense, had a number of stakeholders. So we had to satisfy with this. I was more interested in getting a general sample. Alec Ostry was very interested in rural communities, and HELP was very interested in thinking about just broader BC and how we might be looking at sort of general patterns and how they might play out. In that case, I got to think systematically. Even I'm trying to think timeline on this because we had a lot of discussions about this. I mean, the first and foremost in terms of a preliminary selection was just there were some places where the population density was just too low, where the firm that was collecting the data for us came back and just said, look, there's no way that this is going to be that we're really going to be able to get the numbers that you want, given what are typical response rates and things. So certainly we have that sort of practical consideration going on. The main driver, without getting into the real nitty-gritty, and I guess having you here for about 2 hours, would be that HELP has already did a classification of their different communities throughout BC for which they collect data on early child development, and it identified what they call on-diagonal and off-diagonal communities in relation. So these would be communities that are classified as doing either better than or less or worse than expected in terms of early child development outcomes relative to a socioeconomic profile. They had a multi-item measure which they created for this. And then there might be some that are exactly on diagonal as well. essentially this became, I'm talking here about a clustered sample, but in a sense it was a stratified clustered sample in the sense that then they picked from those cells, we picked communities from there, from each one of those cells, so the on-diagonal and the off-diagonal, while also taking into account regional variation too.
Okay, so
Yeah.
it sounds like it's pretty.
Oh, yeah.
layered. Okay. And then my second.
I'd have to go back to the emails about all this stuff in the Excel files and, yeah.
My second question has to do with how you mentioned that social cohesion was an intricate part of social capital.
Mhm.
And I was wondering if you wanted to measure bridging social capital, where you bring together people of diverse backgrounds and values, then it would make sense that you would need to change the questions that you're asking, the measures.
Well, these are definitely focused on within communities. So we're missing to get at the relative, certainly, right? You're only getting it at one picture of it. And would you need other measures? Absolutely, for that. I'm trying to remember for our instrument if we included things that could qualify really as bridge, or at least extra neighborhood type connections. We have some general measures that we asked about about the relative number of friends that were in that lived in one's neighborhood, things like that, and degree of socialization. But because of just content and once again, sort of the multiple aims and just the total time of having somebody on the phone, we had to keep it pretty basic. So we didn't get into. But no, I'm in full agreement with you on that. There's some really fascinating work that was done by. I believe it was Brian Finch, who's at San Diego State, and his colleagues. I think they were all at the RAND Corporation at the time period. That were found actually that when you're able to adjust for outside neighborhood influences, and actually amount of. In this case, they were looking at the socioeconomic characteristics of other places where people spent most of their time outside of their own neighborhood. They were actually found that it had a suppressor effect on neighborhood effects. On the neighborhood effects that they were finding related to where one lived. So in that case, when you control for the effects that we would normally find actually got stronger. So some interesting, at least if I'm hoping I'm quoting that study correctly. So those types of dynamics are very important to take into account. They can get very tricky because of the types of models that we have, the types of approaches that we have, our need to sometimes measure neighborhoods as a postal code or a census tract or some sort of administrative type of boundary versus people's sort of more fluid movements and how you might model that. But there's a recognition of it. I mean, and there are ways to try to take care of some of those what we kind of termed spatial dependencies and testing out some of these really certainly neat theories. And certainly, this was to show, that you could do something about measuring a particular context. But we can certainly see the importance of, particularly for a more disadvantaged location, to have more bridging ties where they're able to bring resources into a community, right? So we can think here not just beyond neighborhoods to the town to a more regional type of thinking about resource flows, essentially. Yeah, Tom?
Thanks, Rich. Fascinating talk. I'm impressed by the study, particularly when it comes to the sophistication of the methods. I'm not so sure if I'm so impressed about the findings yet, and the theoretical approach that you take. In terms of the findings, those 12%, the response rate. I wonder, would you know anything about the people that actually answered? And would you know anything about those who did not? So that you can kind of estimate what the bias is, and you certainly have biases in there.
Oh, absolutely.
But as you said, it might not be a major problem as long as you know what your biases are.
Sure.
So that would be my first question, and then the second is more the thing.
Yeah, no, absolutely. So in terms of analyzing bias, that's an ongoing project right now. Anthony Smith is also trying to help us figure out not just about who respond. Well, it would be tough for us, given the data that we have, to figure out who responded and who didn't, other than making comparisons to census data and basically seeing, well, how do our respondents match up? And but also, we're also trying to ensure too. We're trying to understand too where our respondents were even within a location, to make sure that to really get in and be thinking about the validity of the responses too. It makes us a little more confident, at least in the findings, in the sense that, I mean, we are seeing patterns that would be consistent with theory. They kind of follow a similar, there's sort of a similar pattern that's going on here. They correlate in the ways that we would expect. So I mean, once again, it comes down to an issue of internal validity versus external validity, and using this model-based approach to helping you make some of those types of corrections. But then you also have, theoretical significance versus substantive significance. So I mean, we're finding correlations that are similar to other locations, but is that a result of the bias? Is that a result of, is there something, should we not be finding it because maybe BC is so unique? So it does raise a whole bunch of questions that we've sat around and we've certainly racked our brains about.
It's easier to deal with when you separate actually the two aims of your study. One is the developing and showing the reliability of your new measurement approach.
Yeah.
And if you would separate this from the more substantive findings, might be easier to deal with this methodological thin ice that you walk on.
We do know, for instance, that there were older women were a bit disproportionately, not a bit, that's not fair. They were disproportionately represented in our sample, for instance. But
Overrepresented.
Yeah, and so
Our respondents are not representative of the communities. I mean, they're older. They tend to be retired. They tend to be, whiter. I mean, you could kind of think that our representative respondent is my mother or other people's grandmothers here. I mean, that's kind of our and so the argument that we, in some senses, have to make is yes, it's not a cross section of individuals in that community, but are the raters who are, even though there's variation across the communities, are those types of raters, do we see them as essentially relatively or valid raters of the types of measures that we're trying to capture? Now, certainly I think other types of measures, if we were trying to get sort of at the issue of ethnic enclaves and things like that, I would have a much greater degree of concern about the representatives of these respondents to get an accurate measure. But I mean, we are in some senses making an argument that the types of individuals that are responding to these types of questions should be able to provide a reasonably valid measure of those constructs within their neighborhood.
And again, kind of a for whom and for what, I mean, so in this case, if you wanted to be looking at drug use, say for instance, I mean, these types of measures, aside from the fact of why would you link, maybe interdistrict racial code, but I mean, all theory issues aside of that, are these the raters where you want to be getting at sort of what the cultural script is of the community in terms of sort of tolerance for, or even availability, or of illicit drug use, so I mean, we can think here sort of problem specific type issues too, and then you had a question about theory.
The question actually is trying to understand, because I'm not an expert in the multi-level analysis, trying to understand this one part, and that may actually lead to a more theoretical issue. That is, your second level, you didn't show us the variables that you used there. You said it's a socio-demographic variable. So I wonder if I understood this correctly. You have a list of socio-demographic variables there, and you account for the variance that these variables bring in. And then on your third level, you have finally what's left for neighborhood. Right? Now, I guess there's quite an overlap between what describes the sociodemographics and what describes the neighborhood. So now if we extract this, and then in our end measure of neighborhood, what's left there? And what is then the meaning of neighborhood if all these other influences are taken out? And that gets me back actually to a mismatch that I'm not very comfortable with. I was totally convinced in your conclusions what neighborhood actually, what an interesting explanatory category this is. But at the beginning you said, oh, it can be anything from a resource or a source of stress or a resource for health. And you started out so neutral, as if we could create a measure that validly tells us something about an outcome without defining the outcome first. I mean, what are we interested in? So what is it that's then there, what makes neighborhood an interesting category when we control for all the other variables on your level 1 and 2?
Well, I mean, this gets back to the for whom and for what. I mean, if I wanted to get into the conceptual stuff, again, this would have been an 8-hour talk. But you raise a very good point. Actually, well, there's several points there. Let me take a step back, and I'm going to hit the first one about the modeling approach. You are fair to say that there is that you could be taking out some variation. I mean, of course, we have selection into certain neighborhoods and certain sorts of social differentiation of who lives in locations. But it's also given the fact that these are small samples that are not going to necessarily be representative of each neighborhood, they would be representative, I mean, at best. You know, I mean, not saying this sample, but what you could really aim to practically do would be get a representative sample of respondents throughout BC, something that would be sort of BC response. But to get a representative within a particular neighborhood would be much more tricky with the smaller numbers and thinking about it that way. So what this is trying to do is get at the rate or differentiation of the fact that you might have in one location respondents who are a lot older versus another location where you're going to be having, you know, I mean, so it's trying to at least basically equalize the bias in that way in terms of the reporting of the responses. The issue that you raised, though, is actually a much more fundamental one, which is one that gets raised in the neighborhood effects literature, and is the idea that from a multi-level modeling approach, you are, regardless of, you've got the best theory, you've got the most right outcome to be looking at this, but from an analytic standpoint, you are estimating what remains after, between neighborhood effect on a variance of an outcome once controlling for everything else. And the idea is that here you're basically dichotomizing compositional and contextual effects in essence. And the idea here that you would have the two interact, and that certainly people create neighborhoods and transform them and make them into their spaces. And so you have these kinds of multi-level processes and arrows going in all different directions that are, and endogeneity issues that certainly exist within your model. That's one way to think about it. The other way to think about it would be, what would be sort of going for a more sort of standard, what's an experimental approach to this, and thinking about what would be if something matters, how could we best isolate what that is, and think about it that way. And that's what in essence, multi-level, there's a lot of criticism of multi-level models that I think are unfounded, in the sense that it's really, it's a much more sophisticated regression model. And certainly regression's got tons of problems too, and we haven't thrown that out the door, and we certainly use that. What I think the point here is to just think of, what are the limitations certainly of an approach? What exactly does that mean for your interpretation? And the most fundamental, getting back to it, is you got to have a good theory. So much of this literature is based on a very kind of inductive approach that leaves you, and sometimes, in terms of your post hoc hypothesizing, well, but is it really this? Is it really that? Thinking about it ahead of time from a more deductive standpoint certainly is the best approach, I would argue, because you're now thinking, not to say that, deductive, I don't want to get on the whole, is deductive better than inductive, and the two inform each other, obviously. But in this case, we know enough now And there's certainly enough theory out there. There's decades of community sociology. There's decades of urban planning literature that we could be bringing to bear on this stuff. And we don't have to be reinventing the wheel in terms of public health and social epidemiology as to what some of these factors might be. So how do we bring those things to bear in terms of designing a project where we could best sort of isolate one type of mechanism and be able to best rule out something given certain situations? So it becomes very much not just theory, but a conceptualization and a research design type of issue too, and not just a certain type of modeling approach. It's like, oh, this is the gold standard, and we're just going to use this, and whatever we find is we'll interpret the results later. And in essence, I mean, that's what's motivating this project too, is just thinking through, not only, are we able to measure something, do it reliably, but really, is there something here with any sort of conceptual kind of meat to it that we can actually be using to really flesh out what does it mean to live in a place where you've got a really high level of poor neighbors?
And that's why I find it fascinating when in your conclusions, you came back to the explanatory power, and if you then would go back all the way and start all over again with your measures and do this several times, you may really be the next Nobel Prize winner. First one then for sociology.
No, that's not happening, not in my lifetime. Where to go with it? I mean, to be clear, I mean, the point that I'm trying to end with here is, here's something that you could be putting in your methodological toolkit, but it's not a substitute for everything else. And so if you don't have the theory, if you don't have the right lens to be bringing to it, this is no different than chasing the latest version of the latest statistical software that you want. Oh, they've got a new module that does this or that. Oh, and I can just run this willy-nilly, right? So, in essence, at risk of coming off sounding a little defensive, I mean, this is intentionally intended to be much more about the methodological sort of arm of that. But better method is never a good substitute is never a substitute for poor or under-theorized theory. And so I think in some ways, I think we might even be arguing the same side of the fence. Yeah. But good points nonetheless, and always good for discussion. Chris?
So I don't really have a question per se, but just, you and I, for a certain extent, I don't think we've done anything else but methods yet. We haven't actually gotten the results. We've just sort of validated something that we haven't looked at in terms of the broader set of context. But one of the things that we remarked on when we looked at how the measures correlated with the census area variables by urban versus rural context is that there were some remarkably different patterns. And I view the findings that we're seeing in the rural communities is somewhat very preliminary for a variety of issues, but nonetheless they're provocative because we're seeing differences in terms of how the empirical base residuals correlate with commonly used measures of neighborhood level resources by urban versus rural context, and that potentially points to some pretty powerful neighborhood level mechanisms how they might differ by urban versus rural context. So I'm just wondering if you can sort of comment a little bit more on that, if you want.
So the question was?
I don't have a question.
Yeah, it's not even a question. The comment was, can I comment to the whole general pattern of findings that that break down by rural and urban? Actually, no, I can't. This is actually why I was bringing it to the group here as something. And the initial aim of this forum was to spark dialogue, and I think over time we might have gotten a little more into the, in some cases, a little more into more of the traditional presentation mode. But I'm actually curious, and I'm too. As 6 years in BC, I'm still too relatively new to the province, and so that's why I'm thrilled that Janice is here, who works with Alec. I was hoping. Now I'm totally bringing you into this now too, hearing your input. Ralph is here, so I'm not. No, I refuse to actually comment on it. I'm actually going to go anti-intellectual or anti-academic, I guess.
Does that? I mean, setting aside.
I'd be happy to put up some of the tables too, if people had some thoughts. I mean, certainly, I mean, I have for every one of those five, I have some speculation, and the neurons are working, but I move outside of my area of expertise, and would feel much better hearing getting.
Would anybody else care to speculate?
Well, one of the things which struck me is that there doesn't seem to be any consideration given to the built environment. People neighbours who live in cloistered and courtyarded areas have very different attitudes from people who live in, for example, tower blocks. And we know that from all the stuff about town planning and the Jane Jacobs on all this sort of nonsense. Radically affects social interaction, how the society is built, whether you put a highway down the centre of a community and so on. If you have great separation of transport from public transport from things, there doesn't seem to be any control for that at all, and that I would have thought would have a tremendous dynamic upon how people interact with each other. Just a guess. But then I'm just an engineer, what do I know?
You know a lot. Well, I mean, this once again gets back to theory, right? I'm totally with you on the idea of the built environment, and this ecometric approach has actually been used to try to look at different assessments of the built environment too, looking at physical disorder, graffiti, and other sorts of other types of indicators. You can test out broken windows theory, things like that. But once again, I mean, environment. Yeah, I mean. You want to get past the idea that we could ultimately achieve somewhere along the line the ultimate data set that's got every variable that we could possibly want, so that we could put it into a model and and that could explain something and get to the idea of of testing specific types of mechanisms. Is the physical environment an important confounder in this? Absolutely. I mean, certainly we would see some of the differentiation. I mean, sort of population concentration. We're getting back to classic sociology about the organization of social life. But looking at specific problems and for specific outcomes, it could really depend. I mean, if we're looking at physical activity, certainly, maybe in that case, it could be something where there is an intersection of things related to social capital, along with the capacity to not just to get attitudes about physical activity, but to but having facilities or at least the built environment that would enable behavior change, for instance. What does it mean instead when you when you live in a community with a high concentration of fast food restaurants, or a place where you've got a lot of places selling cigarettes around you? Thinking to some work of someone I know at the University of Montreal who does work in this area. Yeah, I mean, so that's to me, it's again thinking about in a sense. I mean, certainly this is the point here was just to here's an approach that can be used to be getting at some of these specific types of domains that we might be interested in assessing for a particular study, when data might not other types of data might not necessarily be available. And so I come at this with a bit more of a, kind of a humble kind of view of just, once again, this is something for the toolkit and not necessarily something for the...
I think and also that you looking at a demographic like British Columbia, that doesn't necessarily apply elsewhere. So having lived in Europe a lot, I used to go and eat in alberges, rural alberges, where you have to, like being upstairs in Green College, you've got to eat in a big table and you've got to take what you're given, which forces you to interact with everybody around you. Mm-hmm. If you don't have to speak French, that's tough luck. You learn damn quick, because otherwise you get food you don't like. That forces you to become a member of the community and to take an interest. You don't have any choice in the matter if you want to survive, you want to eat. That doesn't apply anywhere here. Right? If you wish to be a social outcast, nobody's ever going to take the slightest bit of notice of you.
No, I'm sorry, I missed that.
If you wish to be a social outcast, nobody's going to take the slightest bit of notice. Some surveys that have been done recently, which I've found very interesting, is that 1 in 1 in 40 people or something in British Columbia have been here for 5 years, have had dinner in somebody else's home. Okay. It's unthinkable anywhere in Europe.
I didn't hear that. I'd never heard of that study.
2.5%, yeah. Ever get invited into anybody's home, anybody's home for a food. That's not just British Columbia, it's Canada.
Okay.
They're just unfriendly. Canadians are unfriendly.
Well, I mean, so I mean, this is, so the idea here is, once again, to bring it to the big picture of it with, so this is, here you've got, you proposed a number of different types of explanations. Here could be something for which we could leverage at those and testing those hypotheses in a far better way than if we were to just rely upon the standard stuff of what we have, which might be the residential turnover, and getting at more precise measures of about isolation. In some cases, what you might be even talking about might not even require neighborhood level measures. It might be more of an individual level, it might be a level of analysis issue here, and this is an individual level type issue, or less bounded neighborhood and more broader network type of question.
Does your geodata allow you actually to track down your individual results? And could you then estimate the average distance between doors, houses, for example?
Good question.
Would that be a characteristic of the built environment that actually would help to explain some part of the variance in the variables that you are interested in? So does it matter how far the houses are apart? Would your geodata allow that?
I don't think it would. No, I don't think we don't have that kind of detail.
Or the distance
Refined detail.
to a community center, for example.
Yeah, we might be able to do, we could do something sort of more clever in the, this is where I rely on geographers a lot for their input on it, but, so distance from some sort of centroid of a particular location, or the boundary itself, or to use their language, from the polygon, whatever would be the neighborhood boundary within it. But I don't want to get too far. I don't want to make this more than what it is, and I don't want to make it, how to say this. So I want to give a bit more of a nuanced thing about it. The issue here is about creating measures. Find me a measure that's not correlated with something else, right? That there's not going to be some confounding when we think of its relationship with factor, with some dependent variable, right? So in this case, how do we initially even get that information to begin with? And here's something else that we can be putting that we can be using for our research that can then be complemented along with the built environment thing. There's standardized instruments where you'd be sending people out, and that can be reliably done with radars, looking at particular locations and checking out about building structures, other sorts of signs of neighborhood natural qualities, detriments, graffiti, needles, whatever, broken bottles, that kind of stuff. So that is, in a sense, that's a whole other type of data collection. So in this way, so here's something else, as you are of saying, here's a potential methodology too, that given a particular question, given a particular theory that you might be wanting to test, as well as consideration of other factors that you might want to be ruling out, here's at least getting one piece of that puzzle, of something that could be potentially used for that. How does place matter? Pick one. In a sense. We're not going to have a comprehensive theory of it, and so. But in thinking about the different ways that we can be going about thinking about how place matters, here's something else that we can be using. We don't just have to be relying upon census data or administrative data or Google Maps, or making sure that you wear out your shoes walking around neighborhoods and marking off stuff with Chris here, and making sure that you've got and then making sure that your assessments are reliable, or using zoning data, or I'm trying to think of even some other things. store directories, and being able to map those. Just worked on a recent project with a few colleagues about that. So the idea here, I mean, it's saying if we're going to be able, if we want to get some leverage in empirically evaluating the multiple ways in which place matters, what are the different approaches that we could take? And this is one that's been used, only used within a limited context. Could it work? What are some implications, whether it be response or non-response sorts of issues, sampling issues, whether it be money, feasibility. I mean, to me, I come off of it thinking about this in a very optimistic way, and thinking that you could get, forgetting the fact of the nuances of our data, but just the fact of, here's a methodology that based off of what we know statistically, you could, with a limited number of respondents, get a reliable estimate of a particular type of location. To me, I mean, what else could we do? I mean, we could go in, we could do ethnographies for each one of these, and then, you collect all your data, and 20 years later, everything, you get a moving timeline. So I mean, that's not going to work. We need, of course, you need the in-depth stuff, but how can we think about across communities? How can we find some sort of practical and even potentially cost-effective way that also could produce potentially reliable and valid measures of well-theorized, well-conceptualized constructs? And so that's really the take-home message right there. I mean, getting into the nuances of, is it social capital or is it social cohesion? Does trust matter? Is it or not? Is it about reciprocity? Is it about whether or not people, is it about proximity or distance? Is it about bonding or bridging ties? To me, those are all empirical questions to be tested, and that informs the data collection. But what might we have at our disposal in order to be able to take best use or to be able to do the good science to evaluate that? I mean, so that's what it all comes back to.
Well, I'm afraid I have to draw to a close. We're over time.
Are we?
But thank you so much, Rich. That was a fantastic
Well, thank you for really stimulating dialogue, too.
Just want to thank everybody for Green College in particular for their kind and generous hosting of the Population Health series for 2011-2012, as well as, again, thank Rich not only for the great talk today, but also being the lead on now 2 years of what I think is now a very successful series. And we're hoping that in the next academic year we'll be able to continue this tradition. So thank you very much.